My name's Emily. I'm a student nurse at the University of Detroit Mercy. We're going to do an assessment today. Patient is sitting upright, not appear to be in any distress. Patient is dressed appropriately for the occasion. Patient is well groomed. Please. Your name?
Adam Mills.
And your date of birth?
March 28th, 1989.
Okay, do you know what today's date is?
April 3rd.
Okay, where are you at?
University of Detroit Mercy.
And why you're here?
For an assessment.
Patient is alert and oriented ×4. Are you experiencing any pain right now?
No.
Okay, if the patient was in any pain, I have the patient rate their pain from on a scale from 1 to 10, 1 being little to no pain, and 10 being unbearable, excruciating pain. And do you have any allergies?
No.
Okay. Patient. Facial expressions are appropriate. Patient maintaining eye contact. Appears to be the stated age of 24. Patient is cooperative and appears to be comfortable. The patient articulates clearly and articulation is understandable. Okay. The patient, there does not appear to be any obvious signs of illness. And before I continue, do you need to use the restroom?
No.
Okay. I'm first going to start with the head. You put this up. The head is normal cephalic. No lesions or lumps. No signs of parasites. Hair is evenly distributed. No signs of alopecia. Okay. Face is warm to touch and dry. Skin is, the color is even and skin is intact. The eyes, ears, nose, and mouth are all symmetrical. And the patient is well groomed, with an absence of body odors and as well as the absence of breath odors. Okay, I'm gonna check your eyes. First, please stare at the wall for me, please. Alright, can you follow my finger, please? Okay, pupils are equally round and reactive to light and accommodation. Check for conjunctiva, and it's clear and moist. You open your mouth for me, please? And stick out your tongue, sit down. Uvula is midline, tonsils is 1+. Tongue is symmetrical. There's no bleeding. There's no lesions, and the teeth were white and intact. I'm next going to palpate the carotid arteries one at a time. And the carotid pulse is a 2+ bilaterally. And before I move on, cranial nerve, I'm going to test for cranial nerve number 7. And could you smile for me, please? And puff out your cheeks, raise your eyebrows, close your eyes and squeeze tight. Okay, and then will you close your eyes for me again? And let me know when you feel sensation.
No. No. No.
Okay, I test for cranial nerve number 5. Okay. Next, I'm going to auscultate the heart sound. But before I do, I'm going to auscultate the carotid arteries using the bell. Can you take a deep breath in and out and turn your head to your left, please? Okay, you turn on the right to the same thing. Okay, no signs of brewing or swishing. And I'm gonna auscultate the heart sounds using the diaphragm. Go to the aortic valve area, which is the second intercostal space on the right side. We go over to the pulmonic valve area, which is second intercostal on the left side. We go to the herbs, which is the third left intercostal space. And the intercostal space is where the aortic and pulmonic were the second intercostal spaces. Listen to the tricuspid, which is the left lower sternal border, and we go midclavicular on the left midclavicular line in the fifth intercostal space, and listen to the mitral valve area. And it was here where you would use the valve and listen to the apical heart rate for 60 seconds. And then you're going to move back up using the valve in the opposite direction that you came down. S1 is her lattice at the apex of the heart, which is in the mitral valve area. And S2 is her lattice at the base of the heart, which is the pulmonic valve area. And there was no abnormal heart sounds or no additional heart sounds. Now I'm gonna auscultate the lungs. Just start. Can you take a deep breath in and out for me, please, and let me know if you become lightheaded. If you can lift your arm for me, please. Okay, I'm gonna go on this side. Okay, I'm gonna go back over here. I'm gonna listen to the posterior for the lungs, and I'm gonna avoid the scapula and any other bony prominences. Take a breath in and out, please. Okay. Go ahead, breathe regularly. The lungs are clear with no adventitious sounds. Can you lean forward for me, please? Turn the spine. Spine is straight. More curved. Check the coastal vertebral angle for tenderness. Did you feel any tenderness?
No.
And the AP diameter is 2 to 1. Okay. Next, I'm going to ask you to lay down for me, please, so I can auscultate the bowel. Skin is intact. No scarring, no lesions. The color is even. Contour is flat. And the hair is evenly distributed. I'm going to auscultate, starting in the right lower quadrant for the vowel sounds, using the diaphragm. Just auscultated all 4 quadrants for vowel sounds. I started with the right lower quadrant, went to the right upper quadrant, left upper quadrant, to the left lower quadrant. Next, I'm going to percuss in the same order. Okay. There was tympani in the right lower quadrant, the left upper and the left lower quadrants, and there was dullness in the right upper quadrant due to the liver. I'm going to palpate 2 centimeters deep for tenderness. Okay, did you feel any tenderness?
No.
Okay, the umbilicus is midline, and I noticed the nevi, symmetrical, borders even, colors even. Diameter is less than 3 millimeters. And have you noticed any elevation?
No.
Have you noticed any changes in any of the nevi?
No.
Okay. If the patient did notice any changes, I would suggest they tell the doctor. And in the right upper quadrant is the liver, the left upper quadrant is the spleen, and the right lower quadrant is the appendix. Okay, I'll pull that in. And can you sit up? Okay, the skin trigger retracts instantaneously. Skin is one to touch. Check the brachial pulse. That is a 2+ bilaterally. Okay, skin is one to touch and dry. Skin is intact. No lesions. And the radial pulse is a 2+ bilaterally. Check capillary refill. Capillaries refill in less than 3 seconds. No clubbing. Can you cross my fingers for me, please? And the grasp is strong and even in both hands. And then I would check the oral pulse. But I'm going to pet the legs, warm touch. Skin is intact and dry. I'm going to check the popliteal pulse. I would say is a 1+. Hairs evenly distributed on the legs. Check the posterior tibial pulse. I would say that's a 2+ bilaterally. Okay. Then I do the dorsalis pedis pulse. I'd say that's a 2+ bilaterally. Check for edema. For 5 seconds. Okay. No signs of edema. Check the capillary refills toenails. And the capillaries refill less than 3 seconds. I'm going to check the test, do the Babinski test. Toes curvable. On both feet. So it's like a Babinski test. Can you stand up for me, please?
Whoa.
Alright, can you walk over to the door, please? Okay, turn around. I stay near the patient just in case the patient loses their balance. I'll heel the toe all the way back. Patient has a steady gait. Can you turn around? And close your eyes. Put your arms to the side and your feet together. And for 20 seconds, have to wait and watch for any swaying. If there's no swaying, it'd be a negative Romberg test. And that would be complete my assessment.